This one you've never seen, so this is the first time Katie's working with me, and I'm excited about that. So Katie, go ahead and share your screen and take it away.
All right, I am working on sharing it right now. So, can you guys see it?
Yep.
Okay. I lost the Zoom thing somehow though.
Oh.
I am like the worst millennial with technology. It's hilarious.
So if you wave your cursor over, like up on top or at the bottom.
Yeah, it usually is there and it's okay. Well, how about this? If there's any questions, Karen, if you wouldn't mind, I just can't see any of the chat or any people. But if there is any, let me know.
Sure, absolutely.
Okay, we'll make it work. Right.
So Katie, what we usually do is save the questions at the end.
Yeah.
And then we'll just go through them all at the end.
Sounds great.
Okay.
Okay. So yeah, today we're going to talk about pain and recognizing, you know, it says recognizing the many faces of pain. Pain can present in a lot of different ways. So first, the disclosure statement. I'm not, here to promote any particular product, medications, company, anything like that. Our goals, we're going to discuss pain. We want to identify how we can recognize that pain. Sometimes there are some different types of pain. There's different barriers to figuring out what kind of pain someone is going through. And we're also going to kind of develop our own personal system for how we see somebody else that might be in pain. And then our objectives here is pretty much the same thing. We're going to look at different medical knowledge that we have, but also personal experience. We are a society that is very, tuned into our own culture. So what pain looks like, even in Michigan, is going to be different than how people look and view it, pain in California or even in a different country. So it's really important that we're able to incorporate all of those things that we know, because we do take care of a wide range. Yeah.
I'm sorry for interrupting. Your screen, you are showing, just so you know, you're showing, and I don't know if can you see your PowerPoint?
No, I can't. I can kind of see it. Here, hold on. Let me try to do something real quick.
Yeah, because I see your speaker notes. It's not in regular view, if that makes sense. And it's kind of small. And if you can make it bigger.
Hold on one second.
Okay, great. Thank you.
That's what I was worried about. And then I couldn't see it. And I was like, uh-oh. How about that?
It's not showing yet.
Not showing? Okay.
You have to share your screen after you fix it.
Yeah, it might take a minute to load up, I'm wondering. Is that better now?
Yes.
Okay, perfect. All right. See, I told you, worst millennial with technology. All right. So what I want you guys to do is give me your best definition of what pain is. How do you guys think pain is? And you can unmute for a minute, or you can type it in the box. What do you guys think?
A perceived level of discomfort.
That's a really good one. Yeah, perceived level of discomfort.
I would add it's your body's response to something that is wrong or hurting it.
Okay, yeah, your body's response to something that's hurting it. Okay. We'll do maybe one more.
There's emotional and mental pain as well.
Yes. Oh, good. Someone did say that. Yeah, there's a lot of times we just focus on physical pain. And then how do you personally respond to pain? Do we take medications? Do you rest? Do you walk? What type of things do you guys do?
Well, depending on the type of pain it is, if it's physical pain, I may take some medication. If it's an emotional pain, someone died, and I may talk with someone or find some other way to respond to the pain. So it depends on the type of pain that it is.
Yeah. That's awesome. Mm-hmm. Yeah, And what that whole kind of exercise was doing for us, it was telling us we all define pain differently. And that's not bad. That's a good thing. Where it kind of maybe be a little bit bad for us, though, is when we let our own personal opinions as what pain is affect somebody else or how we view somebody else. A lot of times I was a hospice nurse for quite a while. And so I would have patients who would say, oh, my pain's a 6 out of 10, but they are sitting in bed, they're talking to me just like I am to you. And you think, my goodness, you're a 6 out of 10. How can that be? If I'm a 6 out of 10, people know about it. But it's because they've lived with that pain for so long that 6 is a normal for them. And they might say, nope, that's perfectly fine. That's how I want to be. And then you brought up emotional pain too. There's a lot of times that we have to do it for our job, things are happening at home. We're under a lot of stress. We're having our own mental pain that we're going through, but our patients can't know about it, so we've got to put on that happy face. What we forget sometimes is that they're doing that for us too. I always give this example as when I'm doing patient care, it never fails. I go into someone's room and I'm like, how are you doing? How's your pain? I'm great. My pain's 0. And then, a family member or housekeeper walks in and goes, oh yeah, my back's really bugging me today. And I go, why didn't you tell me? Well, you're so busy and I didn't want to bother you with it. I'm like, but that's what I'm here for. So we always have to make sure that we're able to dig a little bit deeper and to really kind of figure things out. Pain is subjective. And then another thing that we mentioned too, what's painful to me might not be painful to you. I always like to think of pain as this fun little cartoon here. I think about it as a boat. And we're sitting on this boat and all of those holes are pain. Now, if we fill up just one of those holes, let's say it's a physical pain and we treat it with, Advil or Tylenol or some kind of a pain medication, we've still got all those other holes to fill in. And now imagine that we don't know where all of that's coming from. We don't know where the water's coming from. And this is when we get into spiritual pain, emotional pain, mental anguish, those kinds of things. It's really easy, for us to sometimes treat physical pain because we've got all these tools in our arsenal. We've got medications, there's hot and cold therapy, but emotional pain, we might not know how to necessarily handle. And the other thing I like to talk about with this is something that's called anticipatory pain. And that I always kind of think of as the rocks as we're sitting on this boat here. We know if we hit those rocks, it's going to hurt. And that happens a lot with procedures maybe that we have our patients go through. They know, anybody get their flu shot this year? And how is everybody kind of flinching and, oh, don't hurt my arm, right? We kind of tense up because we know it's going to hurt. Even before, we even see the needle, we know, oh, this is going to hurt. And that's a really good defense mechanism for our body because it does prepare us. It helps us know, okay, this is going to cause us pain and what can we do? But it can also be a hindrance if the thing that we need to do to feel better is like physical therapy. Well, I know that physical therapy is going to hurt me. I don't want to do it. I'm not going to do it. It's going to cause me pain. I know I have to get up and take a shower, but I don't want to do it. It's too much pain. It's too much effort. I don't want to do it. Then we as caregivers have to figure out where that's stemming from and what can we do to maybe cause there to be less pain if there's going to be pain no matter what, or how do we distract them? How do we reassure them that even though this might be unpleasant, as we talked about pain being an unpleasant feeling or emotion, how can we get through it together? I really like Mosley's definition here because it says it's a multi-system output. It's not just as simple of, I touched something hot, I touched something sharp, and now I'm hurting. Even if think back to the first time that, you put your hand on that stove, right? Oh, it was hot. I know I shouldn't touch it again. But now, whenever we go by a stove, we see, is it hot? Is it hot? Can I touch it? That kind of thing. So it's really important that we always remember it's a multi-systematic approach that's to a threat or a perceived threat. So tell me some of the things that you see in somebody that help you recognize that person is in pain. Well, I
Sorry,
can name
sorry about
um,
that. I
no,
had to treat somebody and I couldn't figure out where it was coming from. So go ahead.
um, how do we recognize pain in somebody? What are some of the things that we can look at someone and say, oh, I bet they're in pain?
They mentioned
Some you can,
tears, increased behaviors, body language,
Body
anger,
language. Yeah.
limping.
Yeah. That pain scale, right? Tell me, what's your pain? 0 being no pain, 10 being the worst pain you ever felt in your life, right? What I want us to focus today on is we described a lot of physical things. We also need to include emotional pain. But how do you assess emotional pain? I mean, you can't just say, how are you feeling? I'm fine. Okay. That doesn't really tell us anything. So that's one of the things that I really want to focus on.
you
Pain is
can
not
also tell by maybe a change if you see the person consistently, maybe a change in the way they dress, or
Yeah.
maybe they aren't doing their hair, or they're not doing their nails, certain things that they normally do.
Yes.
You can tell that way,
Yes,
especially
definitely.
if you
That's
see them
great.
constantly.
Yeah, and if we're lucky enough to see them constantly, for sure. If it's someone who, we just maybe just met, asking, their friends and family, hey, is this normal for them? Do they normally dress themselves? That kind of stuff. That's perfect. Yeah, that's a great example. The first kind of, other than physical pain, I want to talk about is this emotional pain. Some examples of this could be depression. And that's definitely a big one when you see this person normally, gets up and gets themselves dressed and now they're laying in bed. Loss of a loved one. When I would do admissions for hospice, I always asked, what has your experience been with hospice or with losing a loved one in the past? You'd be surprised how many times I had heard, well, we just lost somebody 6 months ago. That's a very, very fresh, loss. I mean, even someone that's passed away 5 years ago, 10 years ago, it's still going to cause some pain. And how they perceived that loss too is huge. I've had some people that said, their death was, really beautiful. It was comforting, and they got to where they needed to go, meaning their kind of belief was heaven. So their pain was relieved. Whereas other times I've heard, oh, it was terrible and they were in so much pain and I wanted to get to them and I couldn't. That's a huge emotional pain red flag there. Family conflicts are huge, or memories of a painful event. Someone who has experienced, my mother's not talking to me anymore, or, I need to talk to my sister about what's happening with mom, but I can't because she won't talk to me. Those are huge emotional pains. Can you guys think of any other?
Well, I think one of the unfortunate parts of this whole thing is, as you said earlier, pain is different for different people. We all have different perspectives of pain. It becomes difficult. My wife may be in some pain, and I'll look at her. Unless she's on the floor writhing in pain, she could be in some intense pain, but she's controlling it. She doesn't want to bother me or whatever. So it really, in emotional pain or spiritual pain, it's really difficult unless you know that person well, to know the level or the intensity of the pain that they're going through.
Yeah. Yeah, and after we talk about some of these examples, I do have some tips and tricks, hopefully that'll help with that too, because it is. I mean, I admit it, when my husband, if I'm having a bad day, my husband goes, how are you doing? I'm like, I'm fine.
All this time you ain't been putting shit in place.
Also gonna mention
Really? this pandemic has been
Yes.
hard for people. Many people, like myself, I live alone,
Right,
and
that's why I put no
clothes,
3 day notice
where
because
to
he
go,
asked to go home.
it's just very hard on people. And then
Yes.
people experience a lot of family members and friends dying, and it's just a terrible time for people.
Yeah, and that's why I think it's so important that we talk about this, and it's to remember that everybody is going through it. I think sometimes, some of the people that I talk to, or even my family, are like, well, I can't talk about it because you have it so much worse than I do. No, no, we all need to be a support system for each other, that's great. Those are great examples. So some of the things that we can do to recognize it, um, sadness, panic attacks, or anxiety. It's really interesting how frequently pain and mental health really kind of overlap. And we don't necessarily always think about it that way. Are they having anxiety because they, have an anxiety issue with behavioral health issues, or are they having anxiety because they're worried that something that's going to happen is going to cause them pain? Um, Hurting oneself is a big one. There are people who cannot take the emotional pain, and so they try to hurt themselves physically to try to dull out that emotional pain. That's a big one, and that's more common, teens, adolescents, kind of, than the older population. But I definitely think it's something that's worth noting. Um, Negative feeling towards oneself, I'm not good enough, I could do better. And then, of course, isolation, drawing away from things that they may have enjoyed once. um, Emotional pain is not as easy to identify as physical injury. If somebody falls and breaks their leg, of course, we know they're in pain. But something like PTSD, I wouldn't be surprised if, some of us, even with this pandemic, are going through this post-traumatic stress disorder, even right now. We see people that we're taking care of, people that we love, get sick very rapidly, and decline. And that's not always easy to see. So the best thing that we can do is, when we think we might be recognizing this, refer them to somebody who can help. That might be a physician, that might be in hospice world. I talk to my social workers and my physicians. There's many a times where I just had a client, like a couple years ago, say that their mom was abusing them when they were little, and they have to take care of mom now. I listened. I, got everything in as much as I could. And I called my social worker right away saying, hey, we've got stuff we've got to work on here. So we'll move on to spiritual pain. Spiritual pain can be very, very tricky. Emotional pain is a little bit easier to recognize because we all feel emotions. Spiritual pain can be a bit more difficult because we don't all believe the same thing spiritually. Certainly, we have people who don't believe in anything at all, but they might still be going through a struggle of, well, what happens after? What happens when I die? Or if we have somebody who, maybe their mom believes in, we'll just say, God and an afterlife in heaven, but they themselves don't. They could be struggling with, well, what happens to my mother afterwards? Not so much of what happens with me. Sometimes I hear a lot of, they're angry with that higher power. Specifically, I hear, why did God do this to me? Wasn't I good enough? Wasn't I a good enough person? Other things might be shunning. There are definitely some spiritual beliefs out there where, if you don't believe the same thing that I do, I can't talk to you anymore. There's also guilt that goes along with, either I don't believe what I used to believe when I was a child, or you know did I offend this higher power in some way, and is that why I'm being punished? There might be something of, I prayed every day, I prayed every single day that mom would get better, and mom didn't get better. So unmet expectations or needs. Those are just some of the examples that I've seen come up quite a bit with spiritual pain. Now, I am not a chaplain, but those are just some of the things that I have got as just from being a nurse. Some of the biggest ways to recognize this with being withdrawn. They used to go to mass all the time, and now they don't want to go anymore. Have they stopped practicing, those beliefs? Maybe there was a religious, custom that they always, every year, everyone came to their house for it. And now they've just decided they don't want anybody to come over anymore. Or just flat out saying, I feel like God's forgotten me. I'm here, and this higher power isn't here for me anymore. Again, the biggest barriers are, we might not understand their belief system. We might not believe in that same higher power. I've been very fortunate that in my experience with this, whenever I've had a patient or a family member that I don't know their customs, I ask, and they've only been too eager to share with me, well, this is what we believe. And I try to do it in a very respectful way. I say, I wasn't raised in this faith, but I really want to know more about it. So, I can do right by you guys. I can do the best thing for you. I try to, get information from my chaplains too, things like that. But it's really important that we understand that they might not believe the same thing we do, and that's okay. I had a daughter who was very, very religious, and mom decided she didn't want to go to church anymore. And the mom had dementia. And so the daughter decided, well, we'll just take her to the chapel anyway. She's not going to know she's there, and it'll save her soul. And it turned into a bit of an ethics issue, but that daughter was spiritually grieving for her mom. She was in some serious spiritual pain. So we were able to help her and work through that, though, which was awesome. Anticipatory pain, we talked a little bit about this already. Getting that shot, I know it's going to hurt. I don't want to go to physical therapy. I know I've heard a lot of our residents that we take care of say that, or maybe a parent or a sibling or somebody. I don't want to do that physical therapy. It hurts too much. I'm not doing it today. But we know as healthcare providers, they've got to do it. They've got to get this done, or it's going to get worse. So things that we can do to maybe help with that, talk to our physical therapist, or if we are physical therapists, working on different interventions to help them so it doesn't feel like so much anxiety and stress going into it. One of the biggest things that I see as a nurse is getting dressed and taking a shower. Turning them sometimes in bed hurts. Just putting their hands up over their arms or their arms up over their head to get that shirt on. So, what kind of different ways can we think about, working around that? Getting to know somebody is definitely the biggest one. Knowing, okay, if, their left arm is the one that's arthritic, so we're going to put, that arm in the shirt first, and that's going to help them. We want to make sure that we're looking at the person that we're going to take care of and let them know, hey, I'm here for you. I understand, that this might hurt you, but I'm here and I'm going to do anything that I can to help you. Sometimes just that reassurance and saying, I've been there, I'm here, we're going to get through it together, can make all the difference in the world. And hopefully you've had an experience yourselves with maybe a caregiver just saying, I'm here for you. And then some of those barriers, we can't really ask someone to rate, how high is this pain that you don't really feel yet? So it's interesting. It's like a blend between a physical and a mental pain. But also they might not fully understand why they're experiencing those feelings. There's an interesting kind of I guess it's like a prank joke or something that you play on somebody, where you have them turn their head and you say, I'm going to put something hot on your hand. I'm going to put something hot on your hand. And you put an ice cube on their hand. And they say that they feel like they got burned because they were told this is what you're going to feel. And obviously they weren't burnt. It was the complete opposite of heat, it's ice. But they will still say that they feel it. So trying to figure out how are we going to convey what we're doing, trying to put ourselves in their position is huge, and choosing our words very carefully to describe those procedures. I do COVID testing now, and I never tell anyone it's not going to hurt because it's very uncomfortable. And I tell them that straight up front. I say, you are going to be fine 5 minutes after this. You're not going to still feel it. But when I do this test, it's going to be uncomfortable. You can squeeze my hand. You can do anything that you need to do. I promise I'm going to be done as fast as I can, but it is going to be a little uncomfortable. And the people that I tell that to are much more relaxed than when I see somebody else do it. That's like, oh, you're going to be just fine. They go right in, and there's much more fighting, if you will, because we are upfront about it. So choose those words carefully for your procedures is huge for anticipatory pain. The next thing here, and I hope that this will help us all as we try to evaluate pain. You can see we've got our nice fun little pain scale there, no pain to worst pain possible. But on the other side here, we have some sample mental health pain scales. I really like this because I'm not a big fan of the faces, but what I like about it is we're able to kind of think outside the box and look at pain from a new way. This was probably the first scale that I saw when I really got into hospice and things that really talked about mental health as a pain scale that we might be able to try to relate, not necessarily to some great chart that we want them to be at a 0, but if I see that someone is a 6, let's say, you can't do things the way that you normally want to do them, and then today they describe that well, today's not that bad of a day. I was able to do a couple of things that I wanted to do. I know that, okay, maybe they're at a 4 now, whereas they were at a 6 a couple days ago. We're moving in the right direction. So whatever interventions that we're doing are making a positive improvement. I mean, for us, that's huge. And yes, just like any other pain scale, it's going to fluctuate. You're going to have good days, you're going to have bad days. But it really helps us to see that there are ways that we might be able to measure and see if our interventions that we're trying for this mental health or this mental pain, emotional pain, spiritual pain, whatever it might be, we're moving in the right direction. So how can we use this as a caregiver? We talked a little bit about making sure that we're able to take our own experiences, maybe incorporating that pain scale, maybe developing something of our own, which we'll talk about in just a minute, of, how am I going to look at somebody differently? If I see somebody, who says, oh, I'm just fine, I'm great, I don't have any pain, but they're more withdrawn, they might not realize that that withdrawal is a type of pain. And how are we going to address that? In our personal life too, I know someone talked about, with this pandemic, we're struggling, and I think you hit the nail right on the head, hit a little sooner than I was going to, but definitely so. We are all struggling right now. I don't know a single person that, isn't worried about how are our kids handling? How is my mom handling? How am I handling all of this? We get new information every day. And yes, we might consider that to be anxiety, but it's also a type of an emotional pain that we're going through. So now I'm going to leave this one up to you guys. Have you discovered something about, pain, or maybe you don't have to say something that you yourself have experienced, maybe a client, that this presentation has maybe made you think, oh, maybe they were experiencing this as opposed to that? I'm putting you all on the spot again.
I put a note in the chat box as you were presenting things, and it reminded me way back in the late 70s, I had to have thyroid surgery done at Henry Ford Hospital. And the nurse came in to see me the night before surgery. And she said, this is a study we're doing through Wayne State, and it involves me teaching you, but I'm going to describe how the pain will feel or the discomfort will feel, and also tell you what to do about it. And it was very sensory focused. And anybody who's ever been through thyroid surgery, your head is hyperflexed back for, you know, quite a bit of time during the surgery. So it's very painful to raise your head post-op. And she went through detail and then had me practice it. And I'm telling you, I remembered every word post-op, and it worked. It really worked. So I really encourage the use of sensory terms. Was very helpful to me.
That's great to hear, you know, that someone was, you know, really trying to describe this is what you're going to feel and everything. That's great. Anybody else find anything? As I was writing this, I kept, you know, reflecting on a lot of the residents that I had taken care of, especially when it came to hospice, because that's, you know, that's kind of where I say I learned about the pain as a whole, that it's not just physical, it's mental, it's emotional, it's spiritual. You know, it's really easy for, I shouldn't say it's easy, it's interesting when you start to look at it as a whole kind of piece of a puzzle. And, you know, when we look at pain, it really is a puzzle. There's something that is called the pain depression cycle. And it is when you're in pain and that pain is debilitating and you can't go out and do things that you want to do. So then you get upset and you get depressed. And that depression can actually change the way that medications are absorbed in your body. It can change the way that they're metabolized. It can change a lot of different things because of all the different hormones and everything that are getting released. So then you get depressed, and then you become less physical because you're more depressed, and it keeps going. It's this very vicious cycle. And it's interesting to see when we can try to break it a little bit. There are, you know, and that might be like a ketamine where someone isn't asleep, but that helps them numb that pain a little bit, just enough to get outside. How, you know, great their day is after that, because that cycle got broken a little bit. Or another way where I've seen, you know, my family doesn't think that I'm really in pain. They don't believe me. And then we work with the patient and the family to explain, you know, what's going on, changing some perceptions of it, and that family bond gets stronger, and then the patient's pain starts to decrease. It's very interesting when you really start to kind of see it work in real life. Anybody else have anything? I tried to kind of drag on so someone else could say if they had any other thoughts.
Well, I think we can become more sensitive to other people's pains and stuff, and not try to impose what we think their pain is, but really to talk with them about what their pain is. I know that as I've gotten older, things that never hurt before are starting to hurt. And so certainly if you're a caregiver of older adults, really begin to ask them about things that when you're 20, 30 years old, you'd probably never ask them, but all of a sudden rheumatism or arthritis or joint pains or other kinds of things like that become something that if I'm caregiving for my mother, and I did that for a while, I became sensitive to some of the things that she might encounter that I wouldn't have thought about. Also, as I've gotten older, I know I developed what's called a trigger finger. I'd never heard of that before. And I had to have that dealt with. Well, that's something now that I'm aware of, that I can begin talking with them when they start complaining about, pain in their fingers or hands or that kind of thing. So just being sensitive if you're a caregiver, being sensitive to the kind of things that older people may incur as pain.
Yeah, definitely. Do we have any like case managers on the line, or I like to think about, or someone that's maybe even runs a nursing home or a skilled nursing facility or an independent living. I always like to think about that emotional pain that they're feeling too. How do you guys think that we could deal with that? This is somebody who's, I mean, probably has some sort of physical limitations too, but sometimes they're saying, I can go back home, I can live home just fine on my own. They're definitely experiencing an emotional pain there. So what do you guys think? What's something that we can do to kind of help them with that?
Well, I'm going to be dealing with a situation like that very soon, and the person has some cognitive deficits after the stroke. So my approach, I do case management in the community, and my approach with my patients, first of all, is to be very honest, but as gentle as possible, and listen to them and be able to realize where they're at, when you try to address things. So hopefully that it's not somebody issuing an edict to them. It's, it's more of a collaborative process.
Yeah, and sometimes that definitely happens where it's, no, you can't live home, you have to go here. I'm sure you do this. I think another good tool, like you mentioned some great ones, being honest with them. Sometimes I say, well, why is it bad? If you've got to move out of your house, tell me why that's bad. And sometimes they just have to think about it. And sometimes it's an issue of, well, I'm independent and I don't need help. Or sometimes it's a very emotional, but that's where my memories are. That's where my home is, and this won't be my home. And when we talk about that, it's a very long conversation, so I won't say it's not, but we also talk about, well, you moved out of your house when you were a child, and then this became your new home. And I usually let them get there on their own. And then we talk about, yep, that was you, we've had another house before, and now this can be your new home. Well, what are some things that, you don't really like about your home you've got now that might be, kind of hurting you? Well, I got to go up the stairs for laundry and down the stairs for laundry. Yeah, that can be difficult. Well, it seems at this place you won't have to do that, so that's a good thing. But to have them kind of work through it themselves too, because it doesn't do them any good if I say, well, but here you're going to have caregivers and you're going to have meals prepared for you, or whatever it might be. Because I might say something wrong that, no, this is what I like, to cook my own meals. So it's always important to ask the why, I guess is what I'm getting at. But that's great. Yeah, definitely honesty with them is awesome. Anybody else have anything?
So, Katie, if you go into your bar above, it says participants or it says chat. Do you know what I'm talking about? Your bar might be where you share the screen.
Yep, I've got participants, but it doesn't have my chat there. I just see a list of the participants.
Is there a ... or anything, like there's more hidden?
Wait. Oh, I see the chat. Thanks, Karen.
Okay. Yeah,
All
there's
right.
you might want to scroll through that quickly because people have made
Yeah,
comments and you can go through all that.
Yeah. Okay. I'm going to look through that real quick as we're going through here.
I know we're going backwards to go forward, but it's just,
yeah, sorry.
I wanted the you to see those comments and to
comment on some of them. Yeah, for sure.
And you could ask the question or mention it now. You don't have to, read it, or, I mean, you can read it out loud if you need to.
Yeah, I'm seeing a lot of the responses to questions that I asked. I haven't come across a question to me yet. I see a lot of people were saying, grimacing, facial expressions for how do we recognize pain, leg tapping. I saw behavior tears. Those are all huge ones. I see big COVID right now. That must be when we were talking about emotional pain. Oh, this one's a good one. I think this is, we were talking about isolation and doing physical harm. Younger are easier to get that physical response to pain as opposed to the older, I'm assuming older adults that are coping with emotions. Yeah, in response to the younger generation, I've known quite a few who have definitely been going through things that, maybe as adults we look at and we're like, that's not a big deal, but to them it's their world. So yeah, definitely. And they can experience that isolation too. So that was a really good point. I remember studying at Henry Ford, focused on teaching sensory terms. What you can control, positioning a limb, breathing in and out. Definitely. Whenever I'm, caring for a client, always use those terms, with whatever you're going to be doing. Sometimes distraction is really great too. If I was doing a flu clinic. I got a story for everything. I was doing a flu clinic, and there was this kid who was in high school, and the only reason I know this is because I was trying to distract him. He was the center lineman, and he was this bulky kid, and you wouldn't think anything would hurt him, but he got so he had such bad anticipatory pain that when I touched him with the alcohol pad, he physically flinched back. I was like, that's just the alcohol pad. So trying to distract someone too sometimes and keep their mind off of it can actually decrease the pain sensations that they feel, because your mind is otherwise occupied. Because remember, we talked about pain is multi-system involved. Loved ones who are ill, I don't think they tell the truth of their pain levels to not upset others. Definitely. I have had that happen a lot. And they also don't, really fully describe their pain. Oh, my head just hurts a little bit, where they can't pick up their head because it's really their neck that's hurting so much. Those things are definitely true. I think I've scrolled pretty much through everything.
Okay.
Okay.
See, they got one more here, and let it go on.
And let it go on to the point they can't
ignore anymore.
Hi.
I'm trying to, it came through a couple different ways, so I'm trying to piece that one together. Peer support and let it go on to the point where they, Sarah, what do you mean by that one? Could you unmute and just?
Well, the peer support was in reference to, I think, something you said earlier about what maybe you could do in terms of someone losing their independence.
Yeah.
And then what I just recently said in terms of letting it go to the point of that they can't ignore it anymore. I just thought of my grandma and her pain. She'll let a minor pain go because she doesn't want to tell anyone. She doesn't want to worry anyone, or we're all busy. But then she lets it go until the point she can't ignore it anymore. And now it's a much bigger problem versus when she would have said something in the beginning, it wouldn't have been, now we're not taking you to the hospital.
Yeah.
If she would have said something in the beginning.
Yeah. Definitely trying to, the way that I phrase it is, I can get your pain from a 2 to a 0 very easily, but I can't get it from a 10 to a 0. It's going to take a lot of time, and some medication that might make you sleepy, which is definitely true. It's hard to, and I don't know why in our culture, it's kind of hard for us to say, hey, I'm in pain. you know, people say, well, I just don't want to bother you. Well, you're not bothering me. I love you. And if I was in pain, would you help me? And they say, absolutely, 100% of the time. Well, let me help you with that too. And that could also go back to some kind of an emotional thing that they're harboring from when they were a child. You know, I've heard some patients tell me, well, don't get the good medication. We need to save that for later, because they were born in the Depression, or a time where, you know, there wasn't a lot of things available to them. To which I reply, if we need more, we'll go to the drugstore. They're not going to run out. It's okay. But it's hard for them to always recognize that I can ask for help, because maybe when they were younger, they couldn't. It's a really big barrier that we still got to try to break down, and it's not always easy. I saw Marty said, but may also feel great right now, but not in 24 hours, which is why they shouldn't go home. Were you talking about going back to their house versus going to like a independent living facility or a skilled nursing home?
Marty, can you unmute?
Yeah, I just did. Okay,
Okay.
no, I was meaning that sometimes somebody's living in their place, in their own home, and then they're thinking that they might go into a care facility, and then 10 minutes later, they're doing fine. But the reverse also happens. They live in a
Yeah.
care facility, and then they think, oh, I could have been where I was, and it was just a few moments, and not realize that there's a pattern
Exactly.
developing, and the pattern gets more bigger and more frequent, and you know, the need gets higher. It's what you said about the 0 to 2 as opposed to a 0 to 10.
Yeah. Yeah, definitely recognizing that. Like, and I think you hit it on the nail on the head there when you said recognizing that there's a pattern to it. Definitely.
I think
Hi.
the interesting thing about pain, and I'm really into the emotional things right now because of the depression that's happening with COVID,
Yeah.
is that a lot of the depression that's happening is because of the isolation, but it is triggering a lot of that older stuff that we might have in our hearts and souls that in a sense we've had more time to think about, as
Yeah.
opposed to if we'd been in a social setting, you know, on a regular pattern basis, you know what I'm saying? Without
Definitely.
COVID isolation.
Definitely. Yeah. You know, you're kind of alone with your thoughts sometimes
It's
now,
been
whereas
too
before
long, too much.
too much. I hear you. You know, we before we were kind of distracted by the hustle and bustle of the world that we didn't know that we had until it was gone. But yeah, and you know, I think it's interesting too, you know, a lot of times we don't want to say, oh, I'm depressed, oh, I'm, you know, emotionally hurt, but it's okay to be physically pain in our culture. Like if we got hurt, you know, we fell down, everybody rushes and goes, oh my goodness, are you okay? You know, but you know, if someone is, you know, looking really tearful and really sad, most people just kind of look the other way. So I really do wonder if we almost kind of shift this focus of, you know, oh, they're just sad, to they're going through emotional pain. You know, would that help more people seek treatment? Would that help more people talk about it? Which is why I'm really kind of passionate about, you know, pain as to more than just a physical level, because I think it is something we do need to talk about more.
Do
And
you
I think
hear the parallels in what you're saying related to abuse and neglect?
yeah,
They go
for
hand
sure.
in hand.
Definitely. 100%. Yeah. All right. Well, if that's my presentation. If anybody doesn't have any more questions.
Can I share something? Can you hear me?
Please. Yes, I love it when you share.
Okay, my name is Jan Tate. I'm a registered nurse and a certified healing touch practitioner and instructor. And I don't know if you're familiar with healing touch. It's a form of energy work, and there's research that shows that it's beneficial with stress, with pain, with illness.
Yeah.
And as a healthcare professional, you can become trained. I teach classes, and but you can also teach a caregiver to do healing touch with their loved one, and you can teach patients to do healing touch on themselves. So that's another option for pain.
Yeah, that's a, great resource to have, definitely. I love it when you guys share things because we all have different backgrounds and different stories, and that's why all my presentations always make you guys talk because I think it's really great to learn from each other.
Janet, I was wondering, how is that different than Reiki?
Healing touch is a nursing intervention, and it was developed by a nurse. And it takes a couple years if you're going to become certified as a healing touch practitioner, and it takes much less time for to become a Reiki. It's also a form of energy work. It's just a different way of using it.
Okay.
Yeah, that almost reminds me too of, have you ever heard of the M technique for
Yes.
nurse? That's almost what it reminds, that healing touch but the M technique is definitely more of a massage therapy, but
Yes.
I think that they go really hand in hand too together.
Mm-hmm.
Yeah.
Yes, they use oils with the M technique.
Yeah, they do. Yeah. And it's the repetitiveness too, that's
Mhm.
soothing and calming and pain relieving too. Yeah.
And if you work with dementia folks, that simple touching, even with a little hand cream, the massage kind of thing, that gentle stuff, particularly because of what's happening with COVID and isolation, and the masks, because they can't measure your eyes and your mouth, voice, and, all of those senses, if you will, huge.
Absolutely.
Definitely. All right, I'm gonna stop that.
I was gonna try to do something.